First off, thank you so much for inviting us out here and letting us come I've never been out here before, and it was a great drive. It's a beautiful area. So thank you so much for allowing us to be here with you today.
Thank you. I'm happy you're here.
Okay, so we're going to cover a lot today.
Okay.
Let's start with the general before we get really specific. How was 2021 for the people of Cowessess First Nation?
It was a roller coaster of emotions. COVID itself coming into 2021 was tired. We were fatigued from COVID. In June, we started our gravesite unmarked graves search. And at the end of June, we told our story. Our emotions were very high. Triggering happened. And then the Prime Minister and Premier visited Cowessess in July. And we signed the first inaugural in this country child welfare agreement, giving us full jurisdiction. And COVID is still going on today. The world knows more about Cowessess now than it did before June. So a roller coaster of emotions, both really good, some triggering, and we are healing.
The pandemic's really been the overarching headline of 2021 for everyone. How has your First Nation managed through 2021 when it goes through managing the pandemic and keeping each other safe and healthy?
We didn't get our first COVID case in the community till 2021. The entire 2020, we were 0 active cases. After New Year's, we got our first case, which we then increased to almost 20. So it brought a panic at the beginning. We thought we were ready, but mentally, emotionally, we weren't. Everybody's wanted lockdown. We thought it was the end, and we got back to 0. Since then, we have fluctuated and it went down to 0. Like right now, today, we have 0 cases. Last week, we had 12. And so it is just tiring. It's becoming a norm. But the biggest challenge is we're gatherers. We're communal people that come together and have food, laughs, meetings. So trying to do everything on Zoom now is becoming a norm. Getting to know what are an elder's homes when you look at them on the screen, or telling an elder, you got to wear your shirt. And there's one funny joke of a male elder sitting there with no shirt on, and I was like, do you know we could all see you with no shirt on? And he sat up real fast and he went put on his shirt. So it's just accommodating to technology while still maintaining our community cohesion.
Was that hard to get that community aspect together?
It still is hard. 50% of our homes, I'm giving a guess, are tech savvy ready for Zoom today. We are still excluding about 50% of our homes due to internet sometimes, due to I don't know what Zoom is, or due to I don't trust looking in my phone and talking, who's recording us, who's listening. So it is increasing though. Like a year ago, we were 25%. So it is getting better. We do understand this pandemic is not going to leave tomorrow. So we're trying to accommodate to still have that cohesion.
How was vaccination uptake out here?
As of today, we're 63% vaccinated of eligible vaccine takers. We're not one of the highest, and we are kind of in the low category. There's a mistrust between the health in this country and Indigenous people. Some have that mindset that the vaccines are a hoax. Some feel we don't want to be the guinea pigs and mentality, but we're not high. We have offered cash. We have offered incentives. We have made some strong policy that you cannot work for Cowessess unless you're vaccinated. So everything we're doing is to try and motivate to keep the minimal risk possible. But vaccines to Cowessess is the solution.
It's pretty incredible, though, that your case numbers are so low, even though the vaccine uptake is not super high. That means that you're very careful.
Our community is amazing. Our Cowessess First Nation, we are not just good-looking people. We do know the role we play with each other, and people are safe. People, when they're out shopping, when they're with family, they practice, the mask wearing, the sanitizing. It's just the vaccine is where we agree to disagree in many conversations, which is human nature. So our rates are low. We unfortunately, we have had a few deaths, some in the community and some externally, our citizens living throughout Canada. And those are just moments of truth at how real this pandemic is and how the end goal is vaccination.